Thank you for coming to be immunised against COVID-19. You are receiving the Moderna Spikevax vaccine today. My name is Dr. Michelle Redford and I am a GP, and I'm going to take you through what to expect after your vaccination. The Moderna vaccine is a safe and effective vaccine. It can be given to people aged 12 and older, including during pregnancy and breastfeeding. Having 2 doses of the Moderna vaccine gives you excellent protection against serious illness from COVID-19, and you will develop that protection in about 12 to 14 days from today. If this is your first dose, you will need to have a second dose after 4 to 6 weeks to make sure that your protection lasts longer. No vaccination can completely protect against all COVID-19 illness, so it's important that we all continue to take precautions and follow the public health advice after we've been vaccinated. If you are unlucky enough to catch COVID-19 in the next 2 weeks before you are fully protected, your second dose of the Spikevax vaccine will need to be postponed. Serious side effects from this vaccine are rare, and the benefits of having protection against COVID-19 far outweigh any risk from vaccination. As a safety measure though, please remain in the observation area until at least 15 minutes have passed. This is so that the team can look after you if you have any side effects. Anaphylaxis is extremely rare after vaccination with this vaccine. Most side effects are mild and more common after the second dose. They tend to start just a few hours after vaccination and settle on their own within 2 to 3 days. Some people don't have any side effects, and the vaccine will still be working whether you have side effects or not. The sorts of things that often happen are a pain at the injection site in your arm, tiredness, headache, aching muscles or joints, fever, and chills. Less common side effects are things like redness or swelling at the injection site, feeling sick or vomiting, enlarged glands, which are lymph nodes, and swelling or soreness in the armpit. If you feel unwell with these sorts of symptoms, you should just rest, and you can take paracetamol or ibuprofen if you like. If you're not sure about what to do, you can use the COVID-19 vaccine side effect checker on the Health Direct website to get some advice. This vaccine cannot cause COVID-19. But if COVID-19 is in your community, you should always be watching out for symptoms of COVID-19. So if you have a fever that starts more than 2 days from now, or continues for more than a couple of days, or you start with a cough, runny nose, sore throat, loss of sense of smell or taste, please get tested for COVID-19 and seek advice from your GP via phone or telehealth. Rarely, the Moderna vaccine can cause inflammation of the lining around the heart, which we call pericarditis, or inflammation in the heart muscle, which is called myocarditis. This is not an immediate side effect. So in the rare cases where it does happen, it starts between 1 and 5 days following vaccination. So you need to know what the symptoms are so that you can seek medical advice promptly if these things happen. So the symptoms would be chest pain or chest pressure or discomfort, difficult or painful breathing, skipped or fluttery heartbeats, or an irregular heartbeat or fainting. Now, most cases of pericarditis and myocarditis have been mild and people have recovered quickly. It does happen a bit more often in younger males under the age of 30 and after the second dose. But as I said, it is rare. If you are well following vaccination, you do not need to change your physical activity or exercise patterns. In Australia, we're keeping a really close eye on side effects from COVID-19 vaccines, and GPs and other vaccine providers are part of the reporting system. If you want to, you can also report side effects yourself via the TGA website. Thanks again for choosing to be vaccinated against COVID-19 today.